The Biden administration has begun shipping vaccine doses directly to community health centers across the country, trying to address the gap between rich and poor in access to vaccines. This is communities of color are fighting against enormous disparities in the vaccine distribution, exacerbated by centuries of justifiable distrust among black people in our healthcare system. Joining me now, Dr. Zeke Emanuel, the Vice Provost for Global Initiatives at the University of Pennsylvania, who served on President Biden's COVID advisory board during the transition, and Dr. Chris Purnell, a New Jersey public health physician in the city of Newark, who took part in the Moderna vaccine trial after losing several family members to COVID. Dr. Purnell, it's been 2 months now since we've talked to you. We now have 2 vaccines, millions vaccinated. How has that worked as far as what you're seeing in your community in terms of vaccine doses and people being willing to take the vaccine?
It's welcome news, Andrea. We won't skirt around the issue or deny that there are those being historically aware of those injustices and ongoing discrimination that aren't quite ready or willing to get vaccinated. But I'm more encouraged by those who are saying, yes, I'm stepping up, I'm signing up, I want to get my vaccine. And I'm even further encouraged by what we're seeing in national polls. Among Blacks and Latinos, there are considerable amounts of folks who are what we call the wait and see category. So they're not a definitive no, but they're impressionable, meaning if we meet their information needs, if we meet their access and logistical needs, then those persons will be able to make progress along their decision journey.
And the Biden administration has just announced today new steps to try to get more vaccines to people. Looking at my notes here from that briefing, the federal government is going to invest $1.6 billion to expand and improve COVID testing in 3 areas: expanding testing in schools, in underserved populations, boosting manufacturing of testing supplies, investing in virus genome sequencing. So I want to talk to both you and Dr. Zeke about that. But what are you seeing, or what do you hope to see now in your community from those changes today announced by Jeff Zients and the team?
This is all encouraging news. What we need to see in these communities that have been hardest hit, like Newark, New Jersey, and other areas in Essex County, is we need to see access to testing, access to PPE, and access to vaccination. Look, if we're going to beat back this pandemic, we need a full throttle public health response. And that had been lacking for so many years in this nation. And what our communities, our Black and brown communities who have disproportionately borne the burden of this pandemic, are welcoming is a sense of empathy, is a sense of focus, and a sense of attention. We know we haven't solved all of our problems, but these are welcome signs. These are steps in the right direction. And we can't let up. I just want to emphasize that, Andrea. As we begin to see bright lights, we cannot let up, because the moment that we let up, we give the virus, we give the pandemic an opportunity to surge forward. So it's hopeful, but I'm remaining vigilant, as are folks in my community.
Of course. And Dr. Zeke, you've been, harping on this failure to do genomic testing. So we don't know where the variants are. We've no way of tracking them compared to other countries. It mimics the failure of testing by the Trump administration. How can the Biden administration catch up on genomic testing, sequencing?
Well, as was just said, this is a good announcement, but I think it's not a full announcement. Today, we're doing about 4,000 genomic tests a week. We're supposed to go up to 7,000 by the end of next week. And this investment of $200 million is supposed to take us to 25,000. But most public health experts think we need to be closer to 50,000. So we still have a big distance to go to really monitor the variants and then begin to rapidly assess whether they're resistant to drugs, monoclonal antibodies, and how they're reacting to the vaccines. So there's still a long way to go. And this should be very high on the top of the list. Otherwise, we're flying blind. We don't know what's out there. We don't know whether it's actually resistant to the vaccines. And that's really dangerous.
And Dr. Emanuel, I want to ask you a viewer question from Twitter at Ferguson Mickey asking, is the vaccine less effective for people over 65? And if so, what is the lower effectiveness number if it's less effective? And how did the health system plan to address that, if at all?
Well, we don't have great data on people over 75. There was some disagreement on the advisory group about those people. On the other hand, the evidence is that they do generate some antibodies. And, you know, if you're offered a vaccine, you should take a vaccine. And you should definitely boost it up. We do boost up the immunity in the community. We all need to take a vaccine when we're offered it. And again, echoing what was said, I think is really important. People see that it's not causing big side effects. People are getting it. We're not seeing a lot of allergic reactions. And that's reassuring to people when they know someone who's gotten the vaccine and it's gone well. Even if they get a day of feeling a little under the weather when they get their second dose, that's really going to encourage people to get the vaccine themselves. Those what was referred to as the wait and see group, really, really important to convince them to get the vaccine because we need to spread it out. But we also should remember there are millions of people waiting. There are teachers waiting. There are people in some states that are not doing the 65-year-olds and older. We really have to get as many vaccines out as possible. We're at 1.6, 1.7 million a day, and we need to ramp that up to 3 million soon to get ahead of the variants that are much more contagious and appear to be more deadly.
You know, exactly. It's a foot race with the variants. Thank you so much, Dr. Chris Purnell and Dr. Zeke Emanuel. Thanks to both. And if you need help figuring out when and where to get your COVID vaccine, our interactive and personalized state-by-state guide has everything you need. Visit planyourvaccine.com or use your phone to scan the QR code to be taken right to the site.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.